so proud to be a Michigander. Since I took office, my administration and I have been committed to lead with transparency and honesty. Obviously, when I took office 15 months ago, neither I nor anyone could have anticipated we would be confronting a global pandemic. So today we have to have a very candid and open, important conversation with you. In just 13 days, we've gone from 0 to 1,232 confirmed cases of the coronavirus, COVID-19. It has doubled over the weekend. This virus is spreading exponentially. And in the ordinary situation, if you get sick, you can go to the hospital. We know that the medical team would have the appropriate personal protection equipment like masks and face shields and gowns. They prescribe some medicine and you'd be okay. But COVID-19 is a global pandemic. It's a novel virus. There's no cure, there's no vaccine. The only tool that we have to fight it at the moment and to support our healthcare system to respond is to give them the opportunity by buying some time. And let me tell you why that's so important. We have roughly 10 million people in our state. There's a model that anticipates that if we stay on our current trajectory, just like Italy, over 70% of our people could get infected with COVID-19. Of that 7 million people projected, about 1 million of them would need to be hospitalized. Let me give you a little perspective here. We have about 25,000 acute care beds in Michigan. Think about that. That's where we are headed currently. So stopping the spread of this virus is really the most important tool that we have right now to keep our communities safe. That means without aggressive additional measures, more people will get sick, more people will die, and our economy will suffer longer. Without additional aggressive measures, soon our hospitals will be overwhelmed. And we currently don't even have enough beds, masks, gowns, and ventilators. But if we all do our part and simply stay home, we have a shot at helping our healthcare system meet our needs. Because this disease can't spread person to person if we're not out there. So we work together and we take this seriously. We can slow the spread of COVID-19. But right now, too many people are still out and about unnecessarily. So we must do more. Our problem has been exacerbated because we're still not getting what we need from the federal government. Last week, the president's message to our nation's governors was essentially that we're on our own to handle getting supplies. Let me just put a finer point on that. We just received our allotment from the federal government's National Strategic Stockpile. The allotment of personal protection equipment for one of our hospitals was 747 N95 masks, 204 gowns, 4,467 gloves, and 64 face shields. Now, with the exception of the gloves, that allotment is barely enough to cover one shift at that hospital. Not even a full day's worth of shifts, one shift. So while I can't do overnight what the federal government should have done over the course of months in planning, my team and I are working 24/7 to secure the things we need. So far, we have secured more than 4 million gloves, 4 million N95 masks, and thousands of gallons of hand sanitizer, thanks to Michigan businesses, Michigan companies, Michigan distilleries, and Michiganders who are pitching in. And while that's a source of pride and that is good, it is nowhere near enough. Now is the most crucial time for us to come together to protect ourselves and our families. We must work together to bend the curve. We must do more to curtail community spread so our health system has a fighting chance. Today I'm issuing a stay home, stay safe executive order for all Michiganders, and it goes into effect just after midnight tonight for at least the next 3 weeks.
3 weeks?
Comprehensive national strategy. We, the states, must take action. We are joining a number of other states that have started, and I anticipate many will follow. States like Ohio and Illinois, New Jersey, California, and many others, including New York. We are doing this because it is absolutely necessary to protect the health of our people. The goal here is simple. Stay home, stay safe, save lives. This will be temporary. This intervention is important to buy time so we can create surge capacity in our hospitals, so we can ramp up testing and develop therapeutic drugs that may lower hospitalization and fatality rates. Please know that even with today's action, the number of cases will go up yet today, tomorrow, and the days ahead. It will take some time for us to impact this. We will be continually evaluating the data, the science, the impact on our health. It is going to take greater testing. We've made strides, but we must do more so we can understand what the challenge is that we are confronting, so we can draw conclusions based on data. It's been observed, if it were possible to wave a magic wand and make all Americans freeze in place for 14 days, 6 feet away from one another, the whole epidemic would sputter to a halt. It's on all of us to do our part. Our ability to safely lift this order will depend on factors like data on COVID-19 infections and the disease's rate of spread. Depend on whether sufficient medical personnel, hospital beds, and equipment exist to meet anticipated medical need, and the state's capacity to test for COVID-19 cases and isolate infected people. I want you to know I didn't make this decision lightly. I've consulted with medical experts from across the country and right here at home, from University of Michigan to Penn to Johns Hopkins to Harvard. Dr. Khaldun and all of these experts recommended today's action, and it is clear this is what we can and must do to protect ourselves. We will all have to make significant sacrifices. By taking this action, we protect our public health and ultimately the hardship on our economy. This is the time we must come together as Michiganders. If we stay home except for essential work and essential needs, we can each be a part of making the difference here. During this time, critical services will remain open. Businesses and operations that do work, that sustains or protects life, can continue to perform that work in person. But in doing that critical work, they must take aggressive steps to minimize the spread of COVID-19 as much as possible. Your grocery stores will be open. I have checked on our whole supply chain for food, and it will be accessible. Do not panic, do not hoard. These services will remain open. Your pharmacy will too, so you can get your prescriptions. Your banks and credit unions. You can fill your car with gas. You can find the full list of critical services that will remain open at michigan.gov/coronavirus. Remember, you can go outside, get some fresh air, walk your dog. Just be smart about it and maintain that 6-foot difference between you and anyone else. And one more thing on the topic of school closures. This order means that our schools will remain closed at least through April 13th. I will have more to say on this subject soon. Now, I know this is hard. I know this is going to be disruptive, and it's certainly going to be hard on our economy as well. But our action will save lives. In the long run, doing this now shortens the time our economy suffers. When we look back at this, we've got to be able to say we did everything we could. On a personal note, I know that the lack of control can be disorienting, so I urge you to focus on what you can control. This crisis can take a toll on our mental health. Check in with family. Call your loved ones. Go for a walk. Read those books on your list, or even go outside and put your holiday lights back up. We must keep our wits about us. That means all of us. Be sensitive to how our kids are feeling. They are not immune from the stress that is going on in this environment. Check in with them and help them understand and give them the reassurance they need. Young people, I'm talking to you now. You're not immune from this. You can get this virus. And in fact, 40% of the hospitalizations and positive cases are among people 20 to 49. You can carry this without even knowing it and be unknowingly exposing others to it. If you don't take this order seriously, we will have to observe these situations longer than we need to. So, to everyone, please be smart. Follow the order. Think about the daughter who has asthma, or the grandpa that has COPD, or the sister who has MS. For the countless healthcare workers who are putting their health at risk to keep all of us cared for. And do it for yourself. We're working to prepare for the long-term economic challenges of this crisis. They will be immense. From unemployment to helping our businesses get back up on their feet. Coming back will take time and it won't be easy. We're working with the business community to help Michigan businesses and employers weather this unprecedented crisis. And we will keep working around the clock to keep Michiganders safe. Please continue to do your part. Stay home. Wash your hands frequently. Avoid touching your face. Cover your mouth with your elbow or your arm. Stand 6 feet apart from one another. And if you think you should be tested for coronavirus, call on the phone. Call your healthcare provider. Our aggressive action today will help mitigate how many people get sick and how long our economy suffers. I've seen some remarkable things in this time of crisis. This is a test unlike any we've seen before. We are up to it. We will get through this. But be smart. Take every precaution and do your part. Take this seriously because it is serious. With that, I'll hand it over to Dr. Janae Khaldun.
3 weeks.